Thank you for joining us here on Health Professional Radio. So glad that you could be here. I'm your host, Neil Howard. Medicare open enrollment is in full effect. The period has started. Our guest is Dr. Jaime Ramos, practicing physician and also medical director of DaVita Medical Group. And he's joining us here on the program to discuss some of the differences in Medicare plans this year as opposed to previous years, and also to offer just a bit of guidance on how practitioners can possibly help their patients to choose some of the resources that best fit their needs when it comes to Medicare. Welcome to the program, Dr. Ramos.
Thank you.
We do know that Medicare open enrollment has started. How long do we have before the enrollment period ends?
So for most patients in the United States, the enrollment period starts October 15th and then ends on December 7th. But one thing that's come out recently from CMS was advising those Americans that live in areas affected by hurricanes. That's something new that they're changing. They're changing the enrollment period for those populations of patients who were affected by the hurricanes in 2017. They extended the deadline, which normally ends December 7th. They extended it to December 31st.
Are those the only changes to the open enrollment rules, especially as they pertain to hurricane victims?
I think to my knowledge, yes. But if you're not sure exactly if you pertain, because there have been a lot of storms in the country, you can go to the website, www.medicare.gov, and they give you more detailed description of the locations and things like that can help clarify that for patients.
Now, especially those patients that we just talked about who've been affected by the recent hurricanes, what about anyone who is either enrolled or planning to enroll? How can they know which plan is best for them?
And it's always a complicated decision. I mean, oftentimes patients seek guidance, and often they usually go to their providers, so their primary care clinicians, to help sort of guide them. And even with all the information available, it can still be very confusing. So normally you ask clinicians to check their resources locally. And normally, in our organization, we tell patients to consult our website. Ours is hcpopenenrollment.com, and that could give them it gives them a structure to sort of who to contact, and then the representative can walk them through the process. I think for clinicians that don't have that type of resource, normally there are several websites, and the one I mentioned previously, www.medicare.gov, can also help patients. But what the challenge, Neil, is oftentimes you have to understand that some patients need some guidance in regards to certain benefits that change, especially with medicine and transportation and copays. Often those become very confusing for patients.
As a practitioner, you're already involved in taking care of your patient with extremely limited time. Not necessarily resources, but extremely limited time. Now you have to find yourself, if I'm understanding correctly, versed in Medicare plans and how they differ. Isn't that a bit much? I know you say you can go to websites, but if a physician is trying to help, and you say traditionally patients kind of relied on the physician to kind of guide them in such a complicated area that isn't physically healthcare related. It's more, benefits and insurance related.
Correct. I mean, unfortunately, as you mentioned, time is a crucial thing for clinicians, and oftentimes to sit down and we often don't have the luxury of sitting down. I think for those clinicians that have the resource, normally you want to redirect them to the ones that you trust that can give some a balanced presentation to patients. A lot of health plans offer sort of seminars and sort of presentations where patients can bring their information and make a sort of an informed choice on what benefits might help them. Patients' needs change every year, and patients need to be aware of the certain time frames where they can make changes that might be beneficial to them. Or if they like their benefits, at least maybe go shop around to see if they can maybe maximize what they can earn with the current enrollment opportunities.
How often do patients throw in the towel and say, I can't do this unless you give me this guidance and be hands-on, because it changes every year. So are we going to have to deal with these changes each and every year for each and every patient with each and every physician?
I think as you set up the challenge, it can be very challenging to try to do that every year for every patient. Oftentimes, the good news is that most patients, when they select the initial plans, they're pretty happy with what the plans deliver. And oftentimes the normal inertia of a patient is just not to change. Most of us don't like changing. So if everything is if they got enrolled, they probably more likely will stay. The guidance comes from the clinician where you see over the year, right, they've had some changes in their conditions. Maybe they needed some different types of medication that you need to prescribe where they have higher copays. Mm-hmm. And as a clinician, I mean, you have to write a prescription because you think it's in their best interest. But from the financial side, that's not something we always consider. But this is where the opportunity where we can say to a patient, look, the open enrollment benefit is, we're in it now. You know, we did change your medications. They're more expensive. You know, go shop around, take a look, see what we can do or what you can do to maybe reduce your costs. Because for a lot of my seniors, some of these more expensive diabetic medications, some of the more expensive treatments can be very cost prohibitive, where they might make choices that maybe don't serve their best medical interests.
Mm-hmm. It's a no-brainer that a person's medical condition changes, maybe gets better, maybe gets worse. They age. Why do you think that it is? Just because people's conditions change, which they are going to, why is it that the benefits change and the enrollment conditions change every year? These diseases are what they are. Why can't the benefits remain what they are? Is it all about the money, or is it about trying to better take care of patients?
I think certainly, I mean, we live in a very large country in different climates, different issues happening around them, and different resources. So what you can find in North Dakota is different than what you can find in Southern California. So a lot of the health plans sort of negotiate what they can negotiate their rates with their hospital partners, their medical groups in their local areas. And also the resources are different, right? So you can see some variability in cost, and plans are try to compete too. You have different health plans trying to compete to provide a better service, and now the consumer has to make a decision based on what they're offering in regards to service. So they're very popular in most plans, especially for my seniors, are like transportation benefits, mm-hmm. Plans that cover optical care. Especially when issues of copay are a matter of consideration. So it is a competitive market, and often they try to get an advantage by maybe perhaps changing prices. But sometimes prices also can affect the level of benefit over time for a patient.
Where's a good resource that patients, caregivers, and practitioners can go and get more information?
I think certainly education is a big one. I think the largest one you can seek is through the federal website, www.medicare.com. .gov. Or if you're in our different areas of healthcare partners, DaVita Medical Group, we have our own portal as well, hcpopenenrollment.com.
Great. Well, thanks for coming in today. Always a pleasure. Hoping that you'll come back and speak with us again in the future.
Thank you very much. You have a good day.
You do the same. You've been listening to Health Professional Radio. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. Subscribe to the podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page at hpr.fm.